Polycystic ovary syndrome. This hormonal disorder is common among women of reproductive age. Women with polycystic ovary syndrome may have infrequent or prolonged menstrual periods. The ovaries may develop small collection of fluid and fail to release eggs. Complications include infertility, uterine bleeding, miscarriage or premature birth, gestational diabetes, hypertension, depression, and other anxiety disorders. Causes. The exact causes of polycystic ovary syndrome is unknown. Some factors may include excess insulin, heredity, excess androgen, and obesity. Diagnosis involves a pelvic exam, blood test, or an ultrasound. Treatments include a common combination of pills and hormone therapy. Guys, if you suspect that you may have polycystic ovary syndrome, please reach out to your doctor. Don't forget to subscribe, like, and share, and thank you for watching, guys. Bye!